All right, so welcome to the Wellness Workshop. We thank you for taking the time out of your busy day to join us. Tonight, we are going to be learning how dizziness and migraine are connected and why. And I'm proud to introduce our occupational therapist, Kari Hart.
Hello.
Hello.
All right, so I am Kari Hart, as Jane knows, a familiar face in the crowd here. I am an occupational therapist here at Mind Plus, and I work a lot on vestibular rehab here. So yeah, let me go into. Okay, sorry. So a little bit more about me. I've been an occupational therapist since 2010, and I, over the years have found a lot of interest in working in vestibular therapy, dizzy, what it means, and how I can help those with that condition. And before that, I worked in a variety of settings, from kids to elderly to acute care to long-term care. So, I've found that it's been really nice to find a home here at Mind Plus, working with a specific group of people that I can do what I find really interesting. So I'm excited to have you here, excited to educate all of you about what it means to be dizzy, what it means to have migraines and be dizzy, and reaching people like you that feel like you feel underserved. And it's just great to reach out to you. So to get started, what I kind of wanted to get going on is, what is vestibular therapy? I've said it a bunch of times. This is what I do here at Mind Plus, but what actually is it and what does it mean? So what is vestibular therapy and what can it do for you? So what is it? It's a treatment for patients with non-resolved dizziness, meaning dizziness that just has not gone away on its own. Motion intolerance, spatial intolerance, like just the inability to handle motion around you, imbalance problems. And this is commonly what we see with an inner ear dysfunction or problems with your inner ear, that this becomes an issue. The management strategy that we do with vestibular rehab obviously includes education like this. It's good to know why you're doing what you're doing. Vestibular imbalance exercises, repositioning maneuvers, and also not limited to cervical strengthening, movement, vision training, manual therapy. Just a lot kind of goes into being dizzy than just doing simple exercises, what is kind of fun for me. So then working with you, it's great to see the progress in people over time. Because it does take time, and that's okay, because that's why we're a team, because we work together to see what really works for you. And that's what I love about it too. Working together and being an active participant in your goals is really the fun part. So after we get goals and you kind of know what's going on, we can move forward from there. So I also kind of want to, as a start, now that you know what vestibular rehab is what is being dizzy. So those with migraineurs, you have a lot of symptoms and there's a lot going on. So there's a lot going on around you, there's going in you, there's symptoms to always be concentrating about, right? Everybody tells you to keep a diary. There's just so much. So what does it feel to be dizzy, and what am I looking out for? So this really, what I'd like to kind of break it down to is where your symptoms are coming from. So this sensation of feeling dizzy. So you can kind of think of it as like you're dizzy, or you're perceiving that the world around you is moving. So like internally, you have inside yourself, you might get that feeling of being lightheaded or just that woozy kind of off feeling. Also feeling that you have a heavy head. I hear from some people that their head just feels like a bowling ball, or like you have a balloon head. Like your head just feels like it's just kind of wobbling all over. And this is where we get that internal self. Like it's not really like you feel like you're moving, but the outside world is staying still, or is as it should be. And then you have this external breakdown, dizziness, where that's where vertigo comes in, and that's where vertigo really is defined as. So where you're turning over in bed and the world around you is spinning. Like literally the room is just coming around your head, and you're in one spot. You're in one spot, but everything else around you is moving, and it can be a very scary experience to have that. And to not know where it's coming from. So it's good to kind of understand if it would happen to you that it's okay, but it is still not fun for sure. So all of these symptoms of feeling dizzy and, either outside or inside, it can produce all these other symptoms that it can throw you off as well. So feeling dizzy, you can get very nauseated with feeling dizzy, especially with this external world spinning. So you have a spin and you just feel like completely like you're gonna, just get nauseated. There's a lot of imbalance problems when you're feeling dizzy. Blurred vision, we call that oscillopsia. So that is, sometimes double vision. That's a little different, but for sure, blurred vision, reading, computer screens are always an issue with people. Getting blurred vision, or when you're in busy environments, that can happen a lot. And so now that we know your symptoms that you can have, we can take a deeper dive to investigate like why this is happening, the anatomy behind it. So when we talk about this inner ear dysfunction, like I had mentioned before, commonly that's what I see with vestibular patients. So your inner ear, I have this picture here, your external ear, your outer ear here, and then it comes in, and where you see it, the inner ear outlined here with the cochlea, that's a little section there is really like your balance center and where your equilibrium comes from. We say it as equilibrium. So your brain wants equilibrium. It wants to be in balance. It craves that, and to do this, we go back to being external and internal. So externally, your brain and your ears, it all relies on what you see. So the vision, what you're seeing around you, and somatosensory being like how you're touching and how your feet are grounded to the ground. Your proprioception of what's going on around you. That your muscle sense information in that area to give you external information about the world, about where you are. Then we see these internal happenings, which is your vestibular system, which is internally inside of your body. So that is your vestibular system, which is your very inner ear. So when things happen inside of that inner ear, it causes a disconnect between that inner ear and the information it's giving to your brain. So here we have the vestibular system as a closer look here. So you have, your vestibular system, the semicircle canals, and then inside of it are those nerves that are really going to come out and give way to being connected into your brain, into the cerebellum there. So the job of this little guy, it's very, very tiny, microscopic. So it's not really visible in any sort of imaging. So what it does is tell your brain where your head is in space. So telling you what direction it's moving, how fast it's moving, when to slow it down, when to speed it up. You know, if someone asks you a question, you know that you need to turn your head to the right and that you need to respond to them. It all gives you that input to be able to do those things and hear what's happening. So when there's damage to this area, to that inner ear, it's what we call a peripheral vestibular disorder. So you can have a peripheral vestibular disorder with and without a migraine. So that's what makes this dizziness kind of hard to distinguish when I see people, is that we have to kind of peel apart what's actually happening. Is there an inner ear dysfunction? Is there something wrong there? Or is it really just your inner ear is completely healthy? There's nothing wrong with it, but then there's maybe something else at play, like your brain is doing something. So this is kind of where we kind of look into there. And I apologize if this is getting a little too technical. Feel free to ask questions if you need to. I tend to move a little fast and I know what I'm saying, so feel free to stop me if it gets a little too confusing. So here's where we say, okay, so we did talk about, now we know how the ear works, how it can, why vestibular rehab, you know, maybe came into fruition because of these inner ear disorders. There's something wrong with my ear. But then what does that have to do with having a migraine? Like, why would that have anything to do with your ear and your brain? So we're going to make the connection here by looking at how that works. So all in all, to be honest, we're all still like learning a lot about, you know, we're always learning about the brain, right? We're always learning about us as humans, but especially those with how migraine works, the theory behind it, how it becomes. There's still people that still believe it's a vascular issue, vasodilation. Some people think it's not. We're kind of moving out of that theory now. So the current theory that's kind of overriding this vascular issue is that it's really a nervous system problem. So we do know to a certain extent that those with migraine are born with this defective nervous system. So it's not your fault. You didn't cause it. You were born that way. And because you're born with a neurologic condition that creates this hypersensitive brain, everything that comes in gets a little bit overexcited. It's hard to adapt to your stimuli. Normally, a healthy brain will be able to take that stimuli in and adapt to it and then move on. There's nothing wrong. I took it in, I pushed it out, and now we're going on. But the migrainer brain has a little bit harder time doing that, especially when there's more than one stimuli coming in. So that makes it a little hard. So because this is harder to do, we get this disequilibrium, inflammation, pain, and vascular disruption is created, and that creates your pain response that you get within your head and whatever part of the brain it happens to find its way into. So we think that this defection in your nervous system actually starts very deep within your brain, and your brain stem over here. You have the cerebellum, as you can kind of see in the bottom of that picture. We feel like it starts in that area, and then once it starts in there, it starts this propagating chemical cascade. So your brainstem creates these chemicals because it's overstimulated, it doesn't know what to do, it's defective, it creates all these chemicals in a response to that. And that cascades pretty much anywhere it does. And there's so many mechanisms that can contribute to that. Without being too technical, you have a trigeminal reflex, these nerves in here, the thalamus, which is noted on that picture, and all these cortical levels that also are involved with stress here, but that cascades into your brain and creates that inflammation and the pain that you feel. So we see here, so that's kind of the brain part of it. And then you see there's a little picture of your vestibular branch there. So we see that there's an overlap of this pathway into the vestibular system. So all of this chemical cascade that happens and this vascular disruption and this pain inflammation, that's all getting overlapped between your vestibular system and your inner ear. So it's all involved together. All those nerves are, segueing together to create the dizziness that you then feel. So it's a very intricate process that can be, very frustrating when it happens to you, obviously, but there's a lot going on within your brain. So, continuing with that, what does that have to do with your brain? So we say, the difference between your inner ear disorder, if you have an inner ear disorder, but what if you don't have an inner ear disorder? Can you have a migraine and have, also an inner ear disorder? Or just because I have a migraine, does that mean I'm gonna just be dizzy? And can I have both, or can I have one without the other? And the answer is yes, of course. You can have one without the other. That's where it gets a little tricky, where I said you kind of have to peel apart all these layers to find out, do you not, is the thought there. So you can have this this new onset of this inner ear disorder. And so a dysfunction in your ear, maybe hair cells got lost along the way. Maybe you had a viral infection that really took over and wreaked havoc on your ear, and now you're having some issues in there. And that can confuse, the brain as well. So you can already have a migraine, have a history of migraine, and now have this new onset of an ear dysfunction, or what we call vestibular peripheral dysfunction. So that can certainly happen. And we know that those with migraine are much more likely to have inner ear dysfunction, just because of the pathway of the nervous system and how you guys are affected, just more likely to develop that. Going along those lines in that little box there, you're 3 times more likely to develop BPPV. That's benign paroxysmal positional vertigo. So that is also an inner ear, not necessarily, it's completely separate from an inner ear disorder, but it is also affecting in that ear. If we go back to this picture, I'll explain a little bit. These little semicircle canals that are pictured here, there's 3 of them, and what can happen is that calcium carbonate can become dislodged from the middle of your ear, either from falling or force or what have you. What we have been seeing that in a migraine, you guys are lucky enough that sometimes it can just happen. Because you are 3 times more likely to develop it. And then that's where those repositioning maneuvers come into the clinic to help you out there with vestibular rehab therapy. So that can give you that world spinning feeling, is when you have BPV, when you lay down in bed and the world around you is happening, and it only happens for seconds. So that is like having a migraine and also having an inner ear or BPPV. This can also all happen in relationship to each other, which can be very scary. Or you can also have an intact ear. Your ear can be just fine. Your inner ear is working great. It's been tested. There's nothing wrong with it. So we categorize this group as the vestibular migraine group. So these are, the people that maybe something has happened within the central nervous system. There has been a change. That chemical cascade got disrupted. There's been a change in there. So, this can cause dizziness as well. So there has been some sort of change within the brain, but the ear has stayed intact. So any sort of change, it's making the brain confused, and it's coming out in the form of dizziness, which can certainly happen. So that I know that can be a little confusing too, to separate the two. So that pathology in the end can cause dizziness with and without migraines. So as we move on here. So now that, kind of we went over what an inner ear disorder is, how vestibular therapy can help. Can you have one without the other? Why am I a migrainer and feeling dizzy? I know we kind of moved a little fast through here, but now, now how do we control it? What do we do about it? what is the main point here going forward. So there is also this thing called the migraine threshold, right? And once you get past that threshold, that's when symptoms first start happening. And a lot of these symptoms can be similar to vestibular symptoms. So like I mentioned before, dizziness, imbalance, nausea, that can all be a thing that happens. Other symptoms of note, is that motion intolerance, just not tolerating even driving a car, being in a busy supermarket. This spatial distortion of where you are can definitely be very problemsome. So this positional vertigo is, a real thing. Having nystagmus, having, sensitivity to lights and sounds, that's all, I'm sure very, you know all about it. It's in your wheelhouse of how to control it, what these triggers are. And a lot of that, and then it comes nausea, and nausea is a little bit difficult to separate too, because, nausea comes in a lot of forms. So this overload of all these stimulus that I just named, that's what triggers your brain. There's so much coming in from the outside world that it's just really hard to get through. And once that more and more stimuli come in, it raises that threshold. And once it tips over that threshold, then that's where that migraine really starts. So that's why we, in therapy, or really anything that you're doing in life improvement, it's hard, if your migraine isn't controlled. So where we start in rehab is really, getting that migraine under control. Not to say that we can't do other things while you're trying to do that, but it's very important that we find, ways for your migraine to be in control, so that you can really work on the other things that are causing you problems, like dizziness. So, and it can, it's so frustrating, because you want this to be under control, but that's not in control. So now you have two problems, and it can be hard, and it's usually debilitating, because it affects migraineurs in the most productive years of your life. You're usually young women, and you have kids, and there's a lot going on, but you have migraine, and now you're dizzy, and now what? So it can be, we understand that it's very frustrating. This also can be, combined with other conditions like depression, anxiety, neck pain, vestibulopathy, and, vestibulopathy going back to the ear disorder. So being that you're more likely to develop it, that can also be in combination there. So, a lot for you to think about, which, it is stressful. So going through here. So now how do you manage your dizziness? So what can you do as a start? Like, okay, now we said I have to get my migraine under control to get my dizziness under control, but then what does that look like? And a lot of migraineurs, they're always told to keep a diary, and it is very important. There's apps on your phone that can do it now, which are so important. Those are so helpful this day and age, with everything being on your phone, where you're having a migraine, you can go right on your phone, put all of your stuff in, and then to look, it keeps all track of it for you, so you can go back, you don't have to write anything down, and then you might be able to see a change over time, which is very helpful than having to write something down every time. So what Dr. B does here in the clinic is, there's a lot of acronyms for these things, right? So we concentrate on what's the word sweet. So outside of the medication that you're prescribed, that is, very important for you to take and to find a medication that works for you. But outside of that, strategies for behavioral intervention become very important. That can help to lower the threshold that I was talking about before, so that migraine doesn't, initiate in the beginning, or it suppresses the migraine once it's started, because which triggers are going to be your worst ones. So we look at SWEET, and that's sleep, water, eat, exercise, and trigger avoidance. Another one out there, if anyone's ever heard of it, is called SEEDS. So that one is very similar, and it has the similar kind of acronyms on there. So, going along with these, we know it's important to get sleep and get consistent sleep. It's not always possible all the time, but it's great to try. Drinking enough water, staying hydrated, not just eating in general, but eating the right foods, eating at certain times of the day, exercising is important. And we do know that a certain amount of aerobic exercise is very, very good for those with migraine. So getting in aerobic exercise every day, getting oxygen into that blood, like making yourself even just more emotionally feel better by doing that. That is really important for those of you with migraine. Isn't always easy either when you already don't feel good and you don't want to get up and work out, but we do what we can. And then trigger avoidance, which also goes into stress management, managing your stress, because stress is a trigger for a lot of people. So working on stress, working on the bright lights, avoiding certain things. And I know that like all of this, like looking at okay, I'm doing like one out of all of these correctly. You could look at them and say, and then you're like, it's easy to get very overwhelmed by all of the things you're not doing right. So that can cause, a lot of people to just give up and be like, well, I can't handle it. So it's really important to start with like small achievable goals. Just pick water. And start there and just add like one more glass a day. And once you get that under control, that you can give yourself a pat on the back and then progress to the next one. And over time, you'll feel like it's just less overwhelming to pick it apart and really focus on one thing at a time. So another management, to manage your dizziness is, coming to vestibular therapy, hanging out with me. So in vestibular therapy, the whole point is to allow your brain to learn compensation. Because if you have an inner ear dysfunction, something's wrong in your inner ear, or something has happened within your central nervous system, and there's been a change, and you are a migrainer. To a certain extent, vestibular rehab therapy has proven to be beneficial in those cases to really take those symptoms and retrain your brain to tell it it's okay, like that it'll get there, but just have to do a little bit of work to tell your brain that it needs to find its new equilibrium. So that's where working with your care team and a cohesive treatment plan is very vital for all of your outcomes. And you know that going to your doctor is important, keeping up with your medications is important, but also keeping up with a home exercise program if you need it. So really being in contact with your care team. So that being said, in contact with your care team, that's where I come in as part of your care team if you would need it. So, part of me, if you're feeling like maybe this is something that you can look into, don't be afraid to ask about it. I am here. There's always availability to see me, even if you just have questions about it. Do I need you or do I not need you? So what would that look like if you had, the inkling you might want to come in and see me? So, you kind of look at these next steps after you do it, and you can feel a little overwhelming to even just make that appointment, but don't be nervous about it. A first visit is just a starting point. We get a lot of background information from you. What's happening? What are your symptoms? Tell me all about the things that are contributing, so we can really break down just from the start how this all happened. And then we really go into all the meat of the vestibular testing. So working on looking at your eye movements, checking for that BPPV, working on balance testing, proprioception, it kind of really looking at the diagnostics side of it to rule in or out certain things that we see here in the clinic. Also looking at your cervical spine, so looking at how your neck moves, how it doesn't move, those kinds of things. And then obviously setting goals. So goals for yourself. What goals do you want to work on? What is something that you really want to do? I had, a patient that said, I really just want to go, I want to walk on the beach. So like anything, just so simple, just as like, I haven't walked on the beach in a long time. I just want to walk on the beach. And those are great. Those are great goals to be able to work towards. And that's why, we're here to help you with that. So, and then keeping on after that first appointment, what to expect is building on what we've learned in that first session and going forward. And, it's hard to say really what, if you needed me, what we would be doing, because, every patient is an N of one. So everyone's going to be different. Everyone's going to have different issues. And it really like to be unique with treatment, unique with treatment plans, unique with what your outcomes can be, because what's important to one person isn't important to another person. So I really love that about what I do, is that, everything is unique. There's a lot of patient-centered care, and that's really fun for me. So, what a treatment plan could include in it: a manual therapy, vestibular rehab therapy, of course, so we just talked about in all these slides, strengthening, balance training, endurance, range of motion, looking at your stresses and triggers. Maybe you're having a hard time identifying them. We're here to kind of help you weed through that. So it's flexible. It's important to be honest and get through it together so that we can get some better outcomes for you and you can, live a better life. So with that being said, segueing, we have what we're introducing is a healing hands, a manual approach to therapy. So with your Mind Plus membership, you are eligible to receive like no charge Interact Healing Hands as part of your membership. So you can inquire about things, you can, you have questions, you want to come in, you are free to do that as part of being a member at Mind Plus here. And, part of that small little session, we can talk about all of the things that you'd like to work on and what we can do to help and go from there.